Welcome back to our webinar covering basic concepts in offering spiritual companionship to adult survivors of child sexual abuse. This 8th session is basically fail-safe responses to survivors. Now, the scope of what this webinar, this session of our webinar will cover are both early responses that are very important early on in your dialogue, but also throughout your relationship with this person, and that may come as some surprise to you, and how they're really no fail. Just by way of reminder for people who might be crashing mid-webinar, I'm qualified to offer this webinar from a point of view of someone who survived clergy abuse. I'm not a therapist, and I'm not a scholar. I'm just myself. I work and help people integrate their Christian and their Catholic faith in recovery from child sexual abuse by clergy and others. And I help people like you offer companionship and guidance to those who have survived abuse. And through healing, I'm trying to help people reconcile both with the past as well as with those who abandoned them, who failed them, with those now who struggle with them, and also with the church, if that would be the case. I talk a great deal about this arc called the trajectory of hope, and we're going to be looking now in terms of your responses at the fact that some responses are needed by people who are survivors, as well as people who feel very much like a victim still. And even when we're thriving, it's the basis of our thriving, and indeed, we can still always bear to hear it. What I want to remind you when you're responding to people, here's something you don't want to do. You don't want to re-victimize somebody, and you definitely don't want to personalize how our reactions can be, especially in some of the most difficult times of our healing, when a lot of the old feelings have to bubble up and be processed before we can let them go once and for all. Now, when I talk about the response and the responses that you can use, I'm going to cover them in 3 different ways: the do's and the don'ts. I'm then going to talk about specific issues and specific points at which you may meet a survivor and some of the responses that you may have. And then also really review the most basic healing words that you can have to use over and over again and can never, ever do you wrong. So let's talk about the do's and the don'ts. I have 6 here. And I'm going to talk about each of them in specifics. What you don't want to do is talk and fill up the silence. We'll be able to tell you're uncomfortable with silence because we are, and we're checking you out. What you do want to do is listen. If listening is uncomfortable, what you want to do is pray as you wait. You don't want to get defensive. In the case of, for example, people with me, and I was abused by a number of priests, you don't want to get defensive about the church and say, well, yeah, but that's only like 10% or 3% and everybody else is good. I didn't need people to tell me that. What was really powerful, though, was to say the church abandoned you. The church harmed you. You don't have to take up my cause. You don't have to turn into an activist. I didn't want that either. But you need to acknowledge the truth of the situation. And similarly, if you hear somebody making accusations about somebody that you thought was an upstanding citizen in your parish or your community, you need to just sit and listen. You don't necessarily have to say, well, I'm sure that they were terrible. You just have to listen and affirm that this was something that this person is talking about that upset them. Similarly, don't minimize it. Don't say, well, that's the past. You should get over it. That's something that a lot of people say. You should be over it by now. You're 45 years old. Fact is, if we could get over it, we would have. We don't write the rules for what you've got to go through when you have to recover. It's better to acknowledge that the person has suffered. That's true. And to acknowledge that that took a lot and that they survived. Similarly, don't own it. And by that, it's one thing to recognize that this is their burden, to recognize that this person has been tenacious, this person has been heroic in their efforts to lead the best life possible despite pain. Those are the types of things you can say to them. What you don't want to do is suddenly merge with them and feel like you've got to carry this pain with them, that you have to feel the pain with them. That's very unhealthy from your point of view. It's also very unhealthy from the survivor's point of view. At first blink, it feels kind of nice if somebody wants to get right in there, roll up their sleeves, and help you solve everything and go through it together. But it's not true. And the only thing that will heal us is the truth. And the truth is, this is a cross we did not fashion for ourselves, but we are left to carry. Don't intellectualize. Now, what I mean by that is, in my case, in the Catholic Church, there's the beautiful, remarkable tradition of scholasticism, and a sort of wedding between abilities to love and to praise God with the intellect. Now, this is an amazing way to infuse all parts of a human being, but it's not the proper place to go. It's not proper to go into the head and talk about this. You have to permit the strong feelings to exist in this room. They may exist in you, but they will exist in the survivor. And they may not even be well articulated or chronological or even make a lot of sense. Feelings don't always work with the intellect that well. You don't want to talk about books that would make sense of this. You just want to acknowledge that these feelings are strong. It makes sense to have these feelings. They won't always be strong as recovery proceeds, but they're really going to be big when we're first moving into recovery. The last thing I'll underscore is, don't try to fix this for the person. Don't be the problem solver. For one thing, this isn't a problem that can be solved. The problem, when it could have been solved, is a long time ago, when the abuser could have been stopped. What you have to understand is accept healing is a process, and we aren't in the driver's seat of healing. And that's why I think, for me, healing wasn't complete until I could take it into my Catholic identity, take it into myself as a Christian, because healing is God's gift. God is in the driver's seat. And until that could happen, my own recovery process was not complete. And chances are, if you're seeking to be a spiritual companion, if this person is seeking you to do that, that's part of what they're seeking. So you should stay out of the driver's seat. Another thing to bear in mind is, in the emotional state that we may well be in the kind of quiet emotional state we may well be in, encouraging people to tell their story is very important. It doesn't mean they have to tell you all of the details of their abuse. That's something that's really best handled in therapy. Why? A, you're not a therapist. B, those details can actually re-victimize ourselves. When we retell our stories in too much depth, we don't know how to come back out of those stories without the help of a trained professional. And when we first kind of tell you pieces and bits of our story, the chronology may be off, the details may be confusing to us until we kind of calm down and get everything kind of organized. That's something we do with a therapist, including finding context. What you need to know is, in the first couple meetings, there may well be a mess. Other people may well have been in therapy for a while and know enough, but other people may take a while to figure out whose job it is to do what. So you may hear some very intense stories. That may be part of why they're sitting in front of you, why they've been moved by the Spirit to tell you first. But again, you're being tested to just listen. And similarly, For example, when I told the diocese of my childhood my history, I only told them about one priest. I tested them. In my mind, at that time, they failed. Over time, lawsuits brought out other abusers. I chose not to sue, and what mattered to me is that these people had all been outed. You too may be told just one little bit and then tested to see how you handle it. So the story may come out over years and years of a relationship as opposed to in the first 1 or 2 sessions. Now that we've kind of talked about what you may deal with, what you may face, you also may be responding to specific issues. For example, it's very common when people emerge from a childhood of abuse that substances have been used to dull the pain, that substances are used to escape what we have to face. And you may very well be dealing with somebody more about substance abuse first before the issue of abuse has ever come up. So don't be surprised if that is the case. Not all substance abusers were abused as children, but many were. Similarly, you may be asked to help somebody who's been cutting themselves or have some other inclination towards self-abuse, or indeed somebody who's attempted suicide. Now, in the case of substance abuse, self-abuse, and suicide, there is only one answer. You can't deal with this childhood abuse at the time when the much greater emergency is just taking care of the person. There's AA, there's NA, there's all the anonymous groups. There are very specialized therapists, and there are medications as well as other types of support groups that can deal with this first, that can stabilize this person well in advance of even trying to talk about the past. And should they try to, it's not as if you want to shut them down, but a voice of reason is to say, let's get everything taken care of so that you're safe here and now. And then we can deal with something as painful as that. But I'm here for you through it. Similarly, you might meet somebody whose relationship is in shambles as an adult. This happens during divorce and annulment. In divorce, often people are forced to face how the past has kept them from having healthy relationships, making good choices in their spouses. That's very important. Similarly, you may find somebody who's in abusive relationships, who's a battered woman or a battered husband, for example, or that they are constantly in places that are very dangerous, almost reckless in their behaviors. In all of these situations, what's really important is to make sure the adult gets into a safe setting. If there are children involved, that the children are in a safe setting. Again, the person gets stabilized. That may involve quite a bit of time, finding a job, being able to support oneself after leaving an abusive spouse. But that becomes much, much more important than dealing with something that will, as a memory, as dealing with the past, will require us to have somewhere safe to go back to withdraw to pray, and to rest. Recovery from abuse is very exhausting. And last, I'll talk a moment about mental illness, but you may well be in a situation where somebody is sharing that they've been diagnosed with some kind of mental illness, whether it's chronic or acute, meaning chronic or situational, whether it happens to be depression or bipolar or some other kind of mental illness, perhaps kicked off by substance abuse. These issues you see in front of you on the screen sometimes are quite connected. Let's talk about mental illness. It's a big bugaboo of mine. I've definitely struggled with depression on and off, but I know people, just by disposition, by intensity, by age of the abuse, psyches can be affected very, very differently. So somebody might walk in and tell you first off their diagnosis. In part, they may just have been diagnosed, and so are not just grappling with perhaps childhood abuse, perhaps substance abuse, perhaps divorce, but also struggling with what does it mean to have this diagnosis now. So when somebody mentions their diagnosis, it's important for you to remember this is a whole person, not a diagnosis. And it's probably kind of nice to remind them that yes, this is a diagnosis, but God sees them as a full person. You don't want to avoid talking about the diagnosis. People are very awkward about this, both about physical diagnoses and mental diagnoses. I took a lot of the abuse and expressed it more in physical illnesses that have stuck with me all along, but these chronic illnesses could just as well have been mental. There comes a point where you can ask about the mental illness. You can ask about the diagnosis. Maybe not intellectually what it is, but what does it mean to this person? How does it play out in their lives? For example, if someone's bipolar, it can look very different person to person, and it will help get insights into what the person is like, as well as what they're kind of struggling with. Don't condescend to mental illness, even in your own mind, like this person is less, is hobbled, is in some way less able to live life. They are your full equal, particularly in the eyes of God. And much as they may be struggling with something, it doesn't mean that they aren't giving other people wonderful gifts by their presence in their lives. It doesn't even mean that their own mental illness might not indeed be something from which they can draw to give to others. So for that reason, I also recommend check even your tone of patronizing through sympathy, through being overly sensitive, in terms of, remember, this person is extremely strong as they stand in front of you. They've managed to survive abuse, which is a terrible annihilation of oneself, and now stand in front of you as an adult who's put life together the best they can. And they're a very strong, tenacious person for doing that. And also check your fear. Check your fear of mental illness and respect this person, because it's not despite what they've gone through, and it's not despite their mental illness, but because of it that they will have many gifts to give the world around them. And often when people are first diagnosed, there's a lot of grieving in that. There's a lot of sense of loss, a sense of kind of shame. And it's important that you are sitting there knowing fully well, while you don't know the outcome of this story, you know they have a lot to offer, even when they don't. So those are my specific cases, and it's really important for you to know that there are referrals. In Catholic dioceses, the victim assistance coordinator often has lots of referrals, but sometimes not, and sometimes they're just not the right referrals, and sometimes the person just isn't ready to connect with the victim assistance coordinator. But you definitely want to have your suicide prevention hotlines. You definitely want to understand that there may be interventions going on with family members. And you want to find out whether it will work or not work if you are in touch with family at all, and only by the introduction and involvement of the survivor. Remember, some family members can have disowned this person. Some family members can be the abusers or their enablers. You also want to be aware that there can be individual and family therapy going on, and absolutely in any of the specific cases I've mentioned, you want this person to be in therapy. You do not want this person relying on you as a kind of emergency backup therapist. Both of you will end up hurt by that. There are other types of options too. For example, for people with panic disorders, there are biofeedback and other types of medical interventions where you actually learn to manage your anxiety through biofeedback practices. There's recovery literature on the shelves of every bookstore and at Amazon and BNN.com. There are 12-step programs that are very successful with all of the things I've listed. And as I've mentioned, there could be a victim assistance coordinator, or if you're with another church, there can be pastors or social workers who work with your church. But remember, you may well be responding to current child abuse. where the abuser who abused this person continues to abuse nieces, nephews, and grandchildren, and that has happened. You need to know the laws and how, if you're a mandatory reporter, and also how to report that. You need to know how to deal with somebody who's in domestic violence at the moment. What shelters, what social workers are available to this person, because the first thing you need to respond to is endangerment here and now. But having said that, having been very sure that the person is getting help, here are some healing words that are used in our program in Arlington, but are really encouraged in all settings. The first and most important thing you can say to anybody is that you're sorry this happened to them. It's true, so they'll sense that it's true, and it's really what people need to hear and may never have heard. You'd be surprised by how many survivors go through 40, 50 years, and no one's ever said that from the heart. For people, for example, in the church who have heard me speak, who've said, yeah, the church failed you, we failed you. That's really important to acknowledge that that failure happened. There are resources for you to understand what the church has done since in the past 10, 12 years to correct that. Certainly that's something still in progress, and as you can see, I'm supportive of that, while I don't pretend that it's perfect yet. You don't have to get into that with this person. With this survivor in front of you, you don't want to say, well, yeah, but the church has done X, Y, and Z, because you're going to sound defensive. It's enough to say, we failed you. I acknowledge that. Let that sink into this person. It wasn't your fault is one of the most important, powerful things you can say to the victim of any crime, but certainly to somebody who is coming at this from having been wounded as a child. Nobody told us for years and years what happened wasn't our fault. And all too many abusers blamed us. And the shame that you walk out of being abused with itself is like a constant voice saying it was our fault. So there is a very powerful statement to say it wasn't your fault, or what happened to you is not who you are. These are very, very important statements. Another way to say it is, you are not what happened to you. These 4 statements, if you use them and use them only in the early sessions, the early encounters, in the casual encounter at the back of a church or in a grocery store like I've had sometimes when people come up when they recognize me from speaking at a prayer service and they whisper their secret. These are the things that if you say and they walk away, you can feel confident that you have said something that will help them be open to the Spirit that has soothed them at some way. I myself have internalized the voices of Father Mealy, who has really helped me a great deal spiritually, and my bishop. They've both said these to me on numerous occasions. Even when I'm feeling down, feeling really close to the abyss of grief, I can call up their voices. Now, I wouldn't believe myself if I said it, but I can hear their voices in my head, and I feel healed. And it's most important to hear in their voices, especially for somebody like me abused by clergy, to hear that I am loved of God. It's very difficult for people to hear. This is not necessarily something that's appropriate for therapy. This is one of the most important statements that can be made in spiritual companionship, in conjunction with all of the other statements which will be said in therapy and in other settings of recovery. What's really important is that as somebody associated with God, as somebody to whom the survivor is turning, as someone associated with God, to say this over and over again. It may sink in. And now that we've talked about responses that are kind of fail-safe, I would hope, we'll talk about boundaries as actually healing, as actually points of reconciliation. So thank you. Just a reminder, teresagreen.org has lots of resources, both on responses. It has a whole session, 90-minute session, on the do's and taboos of how to respond to survivors. And also in Restoring Sanctuary, that chronicles the people I encountered who helped me keep the faith. It really gives you an idea of the range of responses, many of them inadvertently from people of faith, that helped me keep the faith. And Veronica's Veil, which I co-authored with Father Fiorelli, covers a lot of responses that you may find useful. So thank you. We're at the end of this session, and if you've got suggestions or requests, criticisms even, feel free to contact me at the email you see.